All right, welcome to week 2 of the horse course. And in the first lecture, we're going to start talking about basic equine physiology or horse physiology. And we're going to use the horse, but again, all of this will apply to the other subspecies, donkeys, zebras, and what have you. So the basic anatomy of a horse is very similar to other livestock species, but there are some key differences. And it's really important to understand at least their external physiology and the terms associated with that, because a lot of the terms, not only are we going to be referring to them, throughout this course, which we've already done in the previous week and going forward, but, anytime you're involved in the horse industry or you own donkeys, you're going to need to know these terms because we call specific parts of their bodies specific things. So that's kind of why we felt that it was important to kind of, address this in just one lecture. But obviously, you could take an entire Coursera course talking about just physiology. So, we're going to cover what we can this week, and then going forward in the course. So this is just the outlaying area of the horse and the external anatomy. And I know it kind of looks a lot at first, but once you start calling it and getting used to calling certain terms, it becomes relatively easy. And before we jump in and kind of look at specific areas of the horse, I did want to bring this up that 70% of a horse's weight is in its front end. And, we're going to look at skeletal anatomy briefly, and you'll see, some of the reasons why. But, not only do you have the large, chest, shoulders, but the neck and the head all forward of the horse. So that's where a lot of weight is in these animals. Now, if we just focus in on, the front portion of the horse, you can start at the bottom of the chin, or what we call the throat latch, working its way over. And I did kind of want to highlight the crest here. And that just is the area running, all along down the neck. And sometimes you'll hear people say a horse is cresty. Now, sometimes that means, they're arching their neck. We see this with stallions quite a lot, when they're around mares and kind of showing off. But also horses that are overweight, we'll call them cresty in the neck, and that's just because that's an area where they deposit a lot of fat. And starting in week 4, when we get into nutrition, we'll talk more about body condition. So one area to kind of put away, so when we get to nutrition, you can kind of remember that. Now, working your way down the back of the horse, you can see the shoulders, and then of course the withers. We talk about the withers quite a lot. We've already talked about the withers, especially when we talked about hands, measuring the height of a horse from the withers to the ground, and then working your way back, the back and the loin. And then, if you just imagine, this is where a rider would almost sit, and they're kind of in between the back and the loin, and then going down to the tail. Now, looking underneath the horse, what you will find is if you look at the cannon area down, on all 4 legs, those structures are all called the same. So, you have the cannon going down to the fetlock, the pastern, and the hoof. So that's similar between all 4 front and back legs. But when you start dividing front versus back, you do start to see differences. So in the front, you've got the knee, the forearm, the elbow, and then in the back, you've got the hock, the gaskin, and then going up to the stifle. Okay, so there are differences. So it's almost like our front arms are in the front half of the horse, and our legs are in the back half of the horse. And that will be important too when we look at some of the skeletal anatomy. You'll see some of the familiar terms. So jumping into that, I do want to say, don't worry about memorizing certain bones. It's not going to be on an exam or a quiz. But I do want to address it just so you can kind of see, the horse and the skeletal structure and where it is. Again, 70% of the weight. So it's not hard to see from this slide, looking at the large rib area, the neck, the cranium, all that weight in the front half of the horse. That's where it's easier to see that. Now, if we start at the top, just some basic terms of the cranium and the teeth and the neck. But what's interesting is the horse does have this kind of S orientation of the cervical vertebrae. And what's really supporting the neck, not only is the bone structure supporting the neck, but you do have a ligament or series of ligaments, and then quite a bit of muscling in there. So that's really what's helping support the head carriage of the horse. So kind of every time you see a horse skeleton, you see that, and it's kind of surprising. Now, if we just looked at the barrel of the horse, or the main body of the horse, I mean, obviously they have a large shoulder, large scapula bone, and then you can see the different vertebrae going from the thoracic down to the tail. Two areas I did want to highlight is, again, similar to external anatomy, that front portion is almost like our arm. So that's the humerus bone, which is what called here on us. And then they have the femur in the back leg, which is similar to our large leg bone, our femur. Now, looking at the lower anatomy, skeletal anatomy, again, very similar like the external anatomy. From the cannon bone down, all four legs are the same. So you're looking at similar terminology with the long pastern, the short pastern, and then the coffin bone. From that point upwards, there's differences between the front and hind legs. So in the front, again, you have the knee, the carpus, but again, in reference to arm, the radius and ulna, which is actually our lower arm bones, so that's where that is in the horse. And then in the hind end of the horse, obviously you have the hocks, but going up, we have that femur, but then you have the tibia and fibia, which again, similar to our lower leg, there's two bones there. So some things just to kind of remember with skeletal anatomy. Now, muscle anatomy, you're probably thanking me that we would not go over this. It's quite a bit. It's pretty in-depth. It actually gives you a really great appreciation for your veterinarians and other medical folks that need to know all of these muscles. But again, I just put this slide up to show you just how muscular these horses are, how many different muscles are working in conjunction with each other to propel them, to allow them to run as fast as they do and keep them upright. So pretty interesting to see all that. Now, the digestive anatomy, we're going to cover in greater depth during week 4, what each organ does in the digestive tract. But again, just to kind of visualize, the viscera of the horse and just how large these organs are, if you've ever seen them. In a colic surgery, I've been fortunate enough to see a couple of those, and it's just amazing to see how large these organs are. And then going into week 6, we'll cover more into the reproductive anatomy, really focusing mainly a lot on the mare, because that has specific implications for mare management. Now, in our next lecture, we're going to jump into hoof anatomy, and so it's just as important as some of this external anatomy that we talked about. So I look forward to seeing you then.